Hello, my name is Susanna Nicolaens. I am a student at United States University, and today is April 18th. We're going to be filming MSN 572 H and P. Okay. Knock, knock. Can I come in?
Yes.
Okay. So before I came in, I washed my hands. And before I do this, can I get your verbal consent to film and post it on YouTube?
Yes.
Yes? Okay. Okay. All right, so I am your family nurse practitioner, and I wanted to start by, what is your name and last name and your date of birth?
Meriam Arakelian. My birthday is 6/20/1969.
Okay, so you're 57 years old. Okay. Tell me about yourself. What's your gender, your nationality?
Armenian and female.
Female. So you were born and raised in Armenia?
Yes.
Okay. So what brings you in today? How can I help you?
Yearly exam.
Yearly physical. Okay.
Physical exam.
When was your last physical that you had?
Couple months ago.
Couple months ago?
Yeah.
Okay. And let's just start with your history and then you'll tell me about your physical. So do you have any medication allergies?
No.
No medication allergies. What about environmental, food?
No.
Animals?
No.
No known allergies. Okay. So you said your last physical was a couple months ago. You would say like more than 6-7 months ago?
Yeah, maybe,
okay.
yeah.
And did you have a blood test then?
Yes.
You had a blood test, okay. Any abnormal findings with your blood test?
I have high cholesterol.
High cholesterol?
Yeah.
Okay. Okay. And did the doctor give you medication for that?
Yeah, atorvastatin, 20 milligram atorvastatin.
Okay, and once daily?
Yeah, daily.
Okay. All right, since we have that, let me just get a list of your medications.
Yeah.
Can you tell me what medications you take?
Okay, I have propanolol. I have propanolol 20 milligram. I have losartan 50 milligram. I have atorvastatin 20 milligram. And I have pain relief medication, Celebrex 500 milligram.
Celebrex, it doesn't come 500. Are you sure it's 500?
I'm not sure, but
maybe 200.
Yeah, maybe 200. I'm not sure.
How? What milligram was your propanolol? You said
20 milligram.
20. And your losartan?
50 milligram.
And they're all once a day?
Yeah.
Okay. And then for Celebrex, do you take any other pain medication?
Sometime Tylenol, sometime Advil for pain.
Okay. Tylenol is the over-the-counter?
Yeah.
500 one pill every 6 hours? Okay.
Yeah.
Okay. Do you do any recreational drugs?
No.
No. Do you smoke and drink?
No.
Have you ever smoked and drank?
No.
No.
Never.
Okay. So, okay. Do you drink coffee in a day?
Once a day.
Once
in the morning. Yeah.
In the morning. So you would say 1 cup a day? 1 cup. Okay. What is your living situation? Tell me about home. Are you living alone? Do you have kids?
Yeah, I have 2 kids, one son and one boy. I live with my husband.
Okay.
Yeah.
Okay. And your kids are living with you or?
No.
No, they're separate. Okay.
Yeah.
Do you have any grandkids?
Yes, I have 2.
2 grandkids?
Yeah.
Okay. Sorry, I have to ask. Are you sexually active?
No.
No. Okay. Do you go to church? Are you? Yeah. What's your spiritual background? Do you go to church?
Yeah,
do you do,
I go.
Yeah. Okay. Okay. So you mentioned you take 2 hypertension medications, propanolol and losartan. So you are diagnosed with hypertension?
Yes.
And high cholesterol?
High cholesterol.
So, okay. And then what else diagnoses do you have?
I have back problem too. I went doctor. Yeah. And they give me that Celebrex for my back pain.
So you have arthritis?
Also, yeah, arthritis. Also, I have, my doctor gave me for my pain epidural.
Epidural for your back pain. Okay.
Back pain.
When was that and how many injections did you get?
I think last year, maybe 2-3 times.
2-3 times.
Yeah.
And did it
6 months like
every
this.
6 months you had epidural
Yeah,
in your back?
epidural.
And did it help with the pain at all?
Yeah. Yeah.
It helped with the pain. Okay, so besides that, you just take Celebrex for pain and over the counter.
Celebrex and pain.
So since we're talking about that, tell me about your surgical history. What surgeries have you had?
I had got bladder removal.
Okay.
And yeah.
When
and
was
I
that?
have gallbladder. I think it's almost 3 or 4 years ago.
Okay.
Yeah.
Okay. Any other surgeries?
Yeah, I have partial knee surgery, both
your knees.
yeah,
Okay.
knee.
And when was that?
That 2 years.
2 years ago?
2 years, yeah.
Okay.
2 years ago.
Okay. So
And
you
I have the stenosis. Yeah,
you
I
have
told you.
a lumbar
Yeah.
stenosis. Okay.
Yeah.
Have you had
Spinal
any
stenosis. Yeah.
Have you had any X-rays, MRIs done on your back?
Yes.
You
yes.
did? Okay.
That's why they say you have stenosis. Yeah.
Okay. Okay.
Doctor
So,
told me.
tell me, besides the knee partial knee replacement and the cholecystectomy,
I went also heart doctor, cardiologist. They check me everything. Yeah.
Okay,
for my
we'll
heart. That's why
get there. So
yeah.
I'll just write you have a cardiologist. Okay.
Uh-huh.
So let's move on. So you had vaginal births or C-sections, because that's considered a surgery.
Normal.
Two vaginal births.
Yeah.
Okay. So let's move on to your family history. Are your parents alive?
No, they passed away.
They passed away. And what did your father pass away from?
My father had a lung problem.
Lung
yeah,
disease.
Lung disease.
When
yeah.
did he pass away?
2001.
How old was he?
I think it's 68.
68
Yeah, I
years
think
old.
I'm not sure. It's maybe 68.
Okay. What about your mom? How old was your
My
mom when she passed
mom
away?
had heart problem. Yeah.
Cardiac.
Yeah.
Okay.
Problem.
How old was she when she passed away?
84.
Oh, okay, okay.
Yeah.
So, okay. What about? Do you have any siblings, brothers and sisters?
Yes.
What do you have?
One sister and one brother.
Okay.
Yeah.
Do they have any medical underlying?
No,
medical
they
conditions?
okay.
They're okay. What
healthy.
about? Do you remember your grandparents from your?
I'm not sure, but I heard they had blood pressure.
For
Just,
both of them.
Both of them have blood pressure.
Okay, so you do have family history of hypertension and cardiac disease. Okay. Okay, let's just go through your head to toe, your assessment, your body assessment. We'll start from the top. So tell me, do you have any headaches, any blurred vision, any throat problems?
I have my eyes. Sorry, I don't speak very well,
It's
but
okay.
I have my eyes. How to say? Dry eyes. Dry
Okay,
eyes.
and do you take anything for that?
Yeah, the dry eyes drops.
From over the counter?
Yes.
Okay, and I see you have glasses on. You wear glasses?
Yeah.
Okay, not everything. What about your nose? Do you smell everything?
No,
Throat is okay.
everything
No
is
difficulty
normal.
swallowing.
No,
No.
normal.
And then,
yeah.
do you have any depression or sadness?
No, I
No,
think
okay.
good.
So you mentioned that you have a cardiologist. Do you have chest pain, shortness of breath, difficulty breathing? Do you have any of that?
Like a palpitation. I'm
Okay.
scared. That's why I went to the doctor. They check and they say they give me propanol.
So they gave you the
That's why, yeah.
propanol. Okay, so you follow up with your cardiologist once a year
Yes.
or every 6 months?
Once a year.
Okay, and any testing that they have done?
Yes. No, just that. They EKG.
EKG?
Yeah, they did EKG
okay.
and stress test.
Okay, and what were they? Were they normal?
Yeah, normal.
Okay, so your abdomen. How is your bowel movements?
It's normal, maybe. Yeah.
Yeah, normal. Okay. Do you go once a day, twice a day?
Maybe every day.
Every day, once a day.
Once a day. Yeah.
Okay. So, given your age, have you had a colonoscopy done?
Colonoscopy, yes. Maybe 7 months ago.
7 months ago. And what were those results?
Everything is normal.
Okay, so, sorry, given your age, colonoscopy is a preventative screening.
Yes.
Have you had a mammogram and a well-woman exam done?
Mammogram, maybe I done 3 years ago. I'm not sure.
Okay.
Yeah.
What about the well-woman exam?
Yeah, again, same time. Yeah.
What were the findings?
Nothing. It's normal.
Normal? Okay.
Yeah.
All right. Let's go down to your urinary. How are you urinating? Is it normal, color clear? Is any smell?
I think I have a little smell and maybe infection. That's why doctor gave me the medication.
Oh, you had a urinary tract infection?
Urinary tract infection.
Okay, and when was that?
2 months ago.
2 months ago?
Yeah.
And do you remember what medication he gave you?
Ciprofloxacin. Yeah. 500 milligram.
And was how many days?
Every day.
How many days?
How many days? 7 days.
7 days? Twice a day?
Yeah, twice a day. Yeah.
And how are you feeling now? Did it go away?
Yeah.
Okay,
it's very good.
Do you have regular periods or are you menopause?
Menopause.
Menopause, okay. So, your
menopause, I think maybe
when did you
2
start?
years.
Oh, okay.
Almost 2 years.
Okay.
Yeah.
So let's go to your musculoskeletal. So you mentioned you have spinal stenosis, and then you have partial knee replacement. How's your mobility? How are you with the pain? Do you use a cane? Do you ambulate alone?
No, not cane. I walking every day.
Do you?
Little pain, but that's okay. I know I had surgery.
Okay. It's enough with the pain medication?
Yeah.
Okay. Okay. Do you have any muscle pain, any bone pain? How are your lower extremities?
Little pain. Maybe come from arthritis. I don't know.
Okay, so the medication, Celebrex, Tylenol, Advil, it works for you. Okay, great. Do you exercise?
Not too much. I just walking with my dog every day.
Okay, so you walk. You would say 15-20 minutes?
Yeah.
Okay. What about any physical therapy? Have you had any physical therapy?
I had before I have knee surgery. I had that time. That's it. Yeah.
Did it help?
Yeah, little help.
Yeah. Okay. And you don't use anything to ambulate? No cane, no walker?
No.
Okay. No. Okay, let's go down to your skin. How's your skin? Do you notice any new like discoloration or?
I think no. It's normal.
Any new moles? No. Everything's normal.
Yeah.
Is it dry or is it good?
Sometimes dry, but I put lotion.
You put lotion.
Regular lotion.
Okay. And how's your diet? Would you say?
This is difficult. I can do diet, but I try to do diet.
Do you eat healthy vegetables?
Yes, vegetable. Yeah, salad. Yeah.
Have you noticed any rapid weight gain or rapid weight loss?
I heard, but I'm not doing.
No. Okay, so you're just the same weight.
Yeah, same.
Okay.
Yeah.
Okay. So do you So do you have any complaints for me or any questions for me?
Oh no.
No. Okay. So since you did your blood test almost 6 months ago, maybe we could repeat a blood test. And then since you did your mammogram almost 3 years ago and your well-woman exam,
I have to go.
Yeah. Given your age, you have to go once a year. So we would have to do that.
Yeah,
Okay. I think that's it. We will see you back in 6 months to a year for another well-woman
thank you.
exam.
Thank you so much.
Thank you.